And most of foreign people uh, pronounce differently. So my name is Seokpyo Kim. Yeah, I'm very glad to meet you. Hi everyone. It's an honor to be part of joint conference hosting by Thailand Association of Social Workers and Thailand Social Work Profession Council and International Federation of Social Workers. Today's topic I'm going to share with you is the role of social workers in protecting wellness of the elderly in the infectious era as shown in the title. Can you see the slide? Okay. My presentation will focus on what the social workers working in nursing home, specifically nursing home, experienced in the COVID-19 situation. In my presentation, the subject will be the fear of Korean social work in COVID-19 for the implementation of preventive cohort isolation among large scale of infection, protection of care workers from infection, and I will talk about public and private partnership. Fifth, innovative social work applications. Lastly, challenges of the International Federation of Social Workers. Let's move on the field of Korean social workers in COVID-19. Social workers were afraid when the number of new confirmed cases dramatically increased. I lived in Daegu. Daegu has seen the most rapid increase in confirmed cases since early March last year after first outbreak. Also, Daegu has been infected so many people. That's why it's called Daegu as a second Wuhan in Korea. The infection, which started with one religious group, quickly paralyzed the community and reached 5,000 confirmed cases. At the time, community infections were spread widely that we didn't know where and to whom. This reality gave fears to social workers working in nursing homes. The fear was that they would be transmit the elderly they were taking care of by becoming a chain of infections. There are 150 elderly people living in my nursing home. Most of most of the elderly in my nursing homes are people with a severe disease and complex pre-existing conditions. About 40 elderly people in my nursing home pass away per year. Most of them start with a simple cold and then die of pneumonia. COVID-19, a respiratory infectious disease, was a type of pneumonia. So many elderly people were expected to die if they were infected. There are 93 employees in my nursing home. If they are infected somewhere in their community, nursing homes will become a tsunami of infection. Caring is, as you know, caring is work of helping people in their daily lives at close. Due to the nature of work, caregivers are likely to have close contact with the elderly, which indicates that they are in a good environment for infectious transmission. Especially, this COVID-19 has a characteristic that it has a lot of asymptomatic infections. In other words, there was a high probability of infection while we were not aware of it. We are also living as a group. It suggests a higher risk of collective infection. Moreover, the elderly does not wear masks. Even though we tell them to use a mask, they take it off because it's uncomfortable. When looking at these aspects, the probability of infection in nursing home was higher than in any other group. It's a sharp, no, it's hard for managers to imagine the consequence of mass infection in nursing home. If such an infection occurs, the facility must be shut down immediately. Nursing homes are operated by the finance of long-term care insurance for the elderly. In exchange for monthly care for the elderly, the facility is paid by the insurer. If the facility for the senior citizens are shut down due to infection, the financial burden is indescribably high for managers because the elderly will have to take in the hospital and no one will want to be admitted to an infected nursing home. It could have been the biggest management risk for managers or CEO. In other way, the fear of frontline social workers are little different from the fear of managers. It's a mental stress from the stigmatization. If an infection occurs at a nursing home, it will be known nationwide through the news at that night. In fact, one social worker infected at a nursing home had to bear up numerous criticism about his irresponsibility. Modern society is used to stigmatizing. The main stress of social workers is that they should not be a victim of the stigmatization from society. The gossips from other social workers tend to be more stressful. In the next slide, I'd like to address the second part of the main topic, facility response. I'd like to explain the response, what the nursing home prepared before COVID-19, and what they did when COVID-19 occurred. Overall, I'd like to look at initial response and response during massive infection and activities to prevent second wave and restrictions of visitations. Upon hearing of the outbreak of the COVID-19 in China in February, my nursing home conducted an initial response to prevent it. We first purchased the tablet PCs in each living room in anticipation of restricted visitation of the children of the elderly. Video calls were recommended to listen to the family's concern as they were to be difficult to visit in person. One tablet PC for each unit was deployed. So the elderly could always make phone calls and their children could always call to say hello to their parents. This measure has received many good reviews. Thus, the government followed the system of my nursing home and provided more tablet PCs to all nursing homes at a time when the virus was spreading widely. In addition, I unified access in and out of nursing home and created additional self-checking quarantine booths at the entrance of nursing home where visitors can personally quarantine for themselves. What should be done inside the quarantine booth was to check the body temperature, wash their hands at a sink, and spray alcohol cleansers all over the body to prevent the virus from infection chains. At a time of rapid spread of COVID-19, some facilities implemented a preventive cohort isolation voluntarily. Although no one forced them to do so, voluntary cohort isolation was implemented in which both the elderly and the staff live 24 hours a day in a nursing home. However, this measure has a risky point even though it has a good intention, because they started the quarantine without checking whether everyone's health was safe before they started the preventive cohort isolation. Therefore, the nursing homes that implemented the cohort isolation were then given the coronavirus test for all the elderly and workers. And all of them were allowed to begin cohort isolation only if the virus test had been negative. It was a formidable task for all 93 workers and 145 old people to live in one building. Unexpected problems occurred during the preventive cohort isolation period. It was hard because workers did not have a program to spend their leisure time, and there was a lot of stress among employees while living 24 hours a day. More serious than anything else is that there was no private space for 93 employees to live in. Nursing homes mobilized all available resources, set up private tents so that caregivers would have no inconvenience in spending their private time. Sleeping at night was important, so we prepared and provided the thick mats to avoid inconvenience in personal tents. During the quarantine period, we used our time with our staffs through recreation, gymnastics, and playing table tennis, and we also had morning exercise together. The period during which we implemented the court isolation was a period of explosive increase in new confirmed cases in Daegu. I believe that all nursing homes were able to keep the infection rate and mortality rate of the elderly at a low level because of the preventive court isolation in the peak time. This decision was quickly made with close consultation between the government and nursing homes, and it had a surprising effect. To explain how much it was effective, let me show you a simple comparison between hospitals and nursing homes for the elderly. There is a total of 258 nursing homes and 67 hospitals for the older people. The number of beds of each type is almost the same as 15,000 beds. However, the number of confirmed cases in these two groups was quite different. There were 299 confirmed cases in the hospitals, while only 14 were confirmed in nursing homes. That's how much more wellness effort and dedication have protected the elderly in the nursing homes where social workers are responsible for. There was no massive infection of nursing home residents in Daegu, which is a high-risk facility, and the level of collective infection in social work facilities nationwide is minimal. It seems that social workers are protecting well the clients. It contrasts sharply when compared to the statistics of death toll in nursing home of the USA. In some states of America, the average death rate of nursing home was up to 81%. You can see the states, the Minnesota is 81%. After 2 weeks of cohort isolation period, employees went to and from work normally. I made a temporary change to the nursing home commuting system. I had subdivided my nursing home into 4 units. Originally, all units were connected to each other and were usually in the form of easy traffic. But I completely separated it by 4 units. It was separated totally, the space of employees and residents. No contact was allowed, such as coming to work, leaving work, eating, talking, bathing, and having program as well. It was a way to break the change between infection and another infection. We stayed in such a way for 2 more weeks. Visitation to nursing homes have been completely banned since March. The family generally understood well. Contact visits have been available since July. Contact visits were made by meeting family members with the windows between them. For the whole period of 2020, the prohibition and restrictions on visitation were implemented alternately in the line within the state's social distancing phase. As a result of the extended visit prohibition, The depression among the elderly were increased. We sought various ways to solve this problem. In particular, the programs, including video calls through tablet PCs, communications through SNS, and doing things that the family couldn't do. For example, the 15th of August in lunar calendar is full moon day, the most important traditional holiday in Korea. It's called Chuseok. Chuseok in Korea is the day when whole family gathered together. However, Chuseok in 2020 was not able to meet their families. So, on the day of Chuseok, employees came to nursing home even though they were off duties to relieve the loneliness of the elderly. The slide you see is the photo that many older people see the full moon and pray their wishes. Next, I will explain the management of workers during massive infection in community. Due to the nature of nursing homes, workers commute to and from work every day. In the meantime, employees inevitably meet outside people. The management of workers was the most important prevention because the safety of the elderly would be at risk if one of the workers is infected. We supported enough masks for the workers. In addition to the masks, personal protective equipment, PPE, and disinfectant were fully supported. One of the nursing homes in Incheon metropolitan city threw away used masks and providing new ones when they come to the nursing home. Two masks were given each day, one for going home and the other for coming back to work. It was actively implemented at a time when there was a shortage of masks in the early days, but it was mitigated as it became easier to supply and demand masks. Employees were also asked to record their activities after work. There was an element of human rights violation if the nursing home received the private record. Therefore, everybody had to record it and keep it for themselves. This was because to ease of epidemiological investigation if a confirmed case occurred. With the belief that immunity is restored through sufficient rest, we encouraged workers to use more vacations. The employees were allowed to leave work at the exact time so that they wouldn't work extra hours and provide various conveniences. It was because I thought that sufficient rest and compensation for employees were factors that increase immunity. I provide vitamins to all my employees. 4. Public and private partnership. COVID-19 has made it more urgent than ever that the public and private sector should cooperate. I think the fact that there are not many confirmed cases in nursing home in Daegu is a proof that the power of public and private partnership has been well demonstrated. In the early stage of infection, a public-private partnership organization was quickly launched. The council meeting was active when the number of confirmed cases of COVID-19 increased. The council's meetings were always held online. The meeting was a decision-making body that could immediately reflect the need of facility in policy. The meeting was held once a week, where various problems and solutions were decided. This type of meeting was the first of its kind, and we haven't had it before. What was mostly discussed in the meeting was how to prevent infection. Members of the committee were joined by various groups, such as citizens at the metropolitan level and county level and city level, There was also a committee only for social workers who mainly work in the care field. The committee included disabled care, elderly care, child care, and vulnerable care managers. The decisions made at the meeting were implemented immediately. This has led managers and facility workers to have confidence in the meeting and put them into action quickly. Preferential allocation of personal protective equipment to caregivers was conducted. The government has given priority to personal protective equipment for caregivers. Upon the first outbreak of the infection on February 18th, the government provided a large amount of masks for nursing homes, thermal imaging cameras, personal protective equipment, and disinfection supplies were provided specifically for care workers. Fifth, innovative social work practice. It could have introduced three innovative social work practices that led to innovative challenges in the field of future social work. First is using technology. As a lockdown has been sustained for a long time due to COVID-19, social workers have developed the practice of social service in various ways. For children who have not been able to meet their parents who live in nursing homes for a long time due to lockdown, the government tried to increase their intimacy with their families by sporting tablet PCs to be able to make video calls once a day. Staff meeting was held by virtually. This slide shows how we are having a staff meeting every day. Second is that we recognize the importance of psychological prevention. Social workers have been fighting the virus for months in the COVID-19. As a result, social workers working in the field experienced exhaustion, and the need for method of crisis response emerged. Therefore, multidisciplinary help was implemented. The Korean Association of Social Workers worked with the Korean Society for Traumatic Stress Studies, KSTSS, to create a psychological quarantine manual to respond to crisis experience. Psychological quarantine is now the most needed service for clients and social workers in the Corona era. It has become a social service that plays a necessary role in the social work field. Thirdly, there was a transformation of perception of essential workers. In the wave of COVID-19 crisis, there is a growing awareness in Korean society that social workers are essential workers along with medical staffs. Not only in Korea, but also all over the world recognize that we are essential workers. As you see, IFSW Post and UNICEF and National Association of Social Workers in USA, there is no doubt that the International Federation of Social Workers has done a great job during COVID-19. The International Federation of Social Workers shared the ever-changing environment between countries on Facebook and its website in the form of a statement. We learned about each country's situation through data and learned how to deal with it. Various communication between IFSW countries were adapted. SWAN, Social Work Action Network, played an active role with the IFSW. The IFSW was in charge of providing information and linking each other countries' speakers. And the platform that can be shared was regularly provided by Social Work Action Network. Through webinars, they share information about each country's situation and provide opportunities for each other to be challenging. Not only the world-class webinars, also the regional webinars were held. Various topics were held in Europe, and discussions were vigorously held in African region to help countries vulnerable to infectious disease. The Latin American region held an enthusiastic meeting with Silvana Martinez, the president of International Federation of Social Workers. The Asia Pacific region also exchanged opinions through several webinars, including IFSW, Asia Pacific to United Nations. 6.2. Needs of networks between similar practice field has emerged. However, the need for networks by similar affiliation was more required. If there were information exchanged between nursing homes and discussions on how to deal with them, all nursing homes around the world would have been greatly helped come up with the countermeasures. This part remains to be idealized because there would have been better result if networks in different fields had been worked, such as the Disabled Committee, the Senior Citizens Committee, and the Committee for Community. The issue of human rights for the elderly has emerged. There is also regret over the COVID-19 response from the nursing home. It is a challenge to the human rights of the elderly. The human rights of the elderly were restricted in the situation of COVID-19. Things like the human rights of the elderly and caregivers were easy to ignore in infectious era. Even though the issue of human rights has been actively discussed when the time COVID-19 calms down, it is a matter that should be considered from the beginning of the COVID-19 situation. I think the issue of senior citizens' human rights should be dealt with in greater depth in the future. In my conclusion, I would like to propose two things to prepare for the future. First, the need for awareness of with corona. Someone says corona won't disappear, so the terms with corona comes out. We may really have to live with corona for a long time. I'm not sure how to run a nursing home in the era of infectious disease. But it's time for us to think about how to protect wellness of the elderly in the infectious era and what to prepare for with the corona situation at a nursing home where face-to-face contact is essential. Second, the need for preventive equipment and structural preparation. It seems necessary to develop and support essential equipment to live with corona. It means that facility structure of nursing homes should be changed gradually, and more efforts should be made to develop service using high-tech rather than face-to-face labor. I'd like to wrap up my lecture by saying, may peace and safety be with you. Thank you for your attention. Kapun Krab. Thank you very much.